Okay, so if you're a parent, the word croup probably sends a little shiver down your spine. It's one of those things we all hear about and dread, but you're in exactly the right spot. My goal here is to cut right through all that anxiety and give you the confidence and the clear, simple info you need to handle it. You know the sound. It's the middle of the night and you're jolted awake by this harsh, barking cough coming from your child's room. It's a sound that people say sounds like a seal, and honestly, it's terrifying. That is the classic, unmistakable sign of croup. So let's just get right into it.
So here's our game plan. First, we'll cover what croup actually is. Then we'll talk about how to spot the symptoms. After that, we'll get into the really practical stuff, what to do and what not to do for treatment. We'll lay out exactly when it's time to call the doctor, and finally, we'll wrap it all up with the key things you absolutely need to remember.
All right, Section 1. What is croup? We're calling this demystifying the monster because that's really what we're going to do. Once you understand what's actually going on, it becomes a whole lot less scary. So the fancy medical term is laryngotracheobronchitis. Yeah, nobody says that. We just call it croup, thank goodness. All it really means is that there's an infection causing swelling in the upper airways. We're talking about the voice box and the windpipe. The best way to picture it, think of a really narrow tunnel. Now imagine there's a traffic jam right in the middle of it. That swelling is the traffic jam, and it's what's causing all the problem.
So how does this whole thing start? Well, it's almost always a virus. The most common culprit is something called parainfluenza. It spreads just like a cold, through coughs and sneezes or by touching something the virus is on. Once the virus gets in, it sets up shop in the upper airways. That's what triggers the swelling, the airway gets narrower, and boom, you get that scary cough.
And this is the key age range right here. Croup really loves to pick on kids between about 6 months and 3 years old, and there's a simple reason for that. Their little airways are just tiny to begin with, so even a small amount of swelling can make a really big difference and cause some serious trouble breathing. Okay, so we know what it is and who gets it. Now for the really important part, recognizing the symptoms. This is all about learning how to read the signs your child is giving you. Right, here's what you're looking and listening for. First and foremost, that loud, barking, seal-like cough. It's the headline act. And you'll notice it gets so much worse at night. There's actually a reason for that. Our body's natural steroid levels drop when we're asleep, which lets the inflammation get a bit worse. You'll also probably hear a hoarse voice or a scratchy cry, some noisy breathing, and yeah, there's often a fever that comes along for the ride.
Okay, listen up, because this is probably the most important part. You need to know the signs that things are getting worse. The first is called stridor. It's a high-pitched whistling sound you hear when your child breathes in, not out. The next thing to look for is retractions. This is where you can actually see the skin pulling in tight around their ribs or at their neck every time they take a breath. Stridor, retractions, and then other signs like being really lethargic or, and this is a big one, any pale or bluish color around their lips. Those are all emergency signs.
So, you've spotted the signs. What do you do now? This next section is your action plan. We're going to cover the do's and the don'ts of treatment, what works and what you should absolutely avoid. All right, let's talk about what actually works. These are the go-to, evidence-based treatments that doctors use. The number one absolute cornerstone of croup treatment is a steroid. Usually it's one called dexamethasone, and it's important to know what it's doing. It doesn't fight the virus. What it does is attack the swelling. It's a really powerful anti-inflammatory that goes right to the source of the problem and reduces that inflammation in the airway. This is the thing that brings real relief. Now, for those scarier, more severe cases, you'll see doctors use something called nebulized epinephrine. This is a hospital-only treatment, and it's basically a fast-acting rescue medicine. It works in just a few minutes to open up those airways and give immediate relief. It's not a long-term fix, it buys time for the steroids to start working their magic. Okay, we've covered what works. Now for what to avoid. And this is huge, because it's so easy to make these common mistakes when you're just trying to help your kid feel better. If your child has an asthma inhaler, like Ventolin or salbutamol, do not use it for croup. It seems like it would help, right? But it won't. Here's the deal. Asthma meds work on the tiny little airways deep down in the lungs. Croup isn't in the lungs. It's a problem way up high in the windpipe. So that medicine is basically targeting the wrong address. It's just not going to work.
It's so tempting to reach for an over-the-counter cough medicine or a decongestant, but again, you've got to resist. The simple truth is there's zero evidence that they do anything to help with croup. They might make you feel like you're doing something, but they don't actually help the problem. So best to just leave them on the shelf.
And the last big don't, antibiotics. This one's simple. Remember what we said at the beginning? Croup is caused by a virus. Antibiotics kill bacteria. They do literally nothing for viruses. So giving antibiotics for croup is like trying to put out a fire with a sandwich. It's the wrong tool for the job. This is maybe the biggest question you'll have in the middle of the night. Do we stay home or do we go to the doctor? So let's create a really clear roadmap for you based on how severe the symptoms are. Let's start with mild croup. So you hear the barking cough, and this is key, there is no stridor and no retractions when their child is just resting calmly. In this case, you'll see a doctor, and they'll probably prescribe that oral steroid, dexamethasone. After that, your job is simple. Give the medicine and just keep an eye on them, watching for any of those signs that things are getting worse. Okay, now let's level up to moderate croup. This is when you do see that stridor and the chest retractions, even when your kid is calm. This is your sign to get them checked out, for sure. The doctor will give them the dexamethasone, but then comes a waiting game. They'll need to be observed for a few hours. If things are looking better in about 4 hours, that's when a hospital stay might be on the table. And this is severe croup. This is an emergency, no question about it. You'll see the stridor, you'll see the retractions, and your child will seem either really agitated and upset or the opposite, really tired, sleepy, and lethargic. If you see this, you go to the hospital immediately. Don't wait. They'll need urgent care. We're talking oxygen, that nebulized epinephrine, and steroids, and they will absolutely need to be admitted to the hospital.
Okay, let's boil this all down to the absolute essentials. What do you need to remember? Number 1, the seal bark and stridor are the key sounds. Number 2, steroids like dexamethasone are the main treatment. Number 3, antibiotics and cough syrups are useless here, so don't use them. And number 4, and this is the most important, severe distress, retractions, lethargy, any blue color is an emergency, period.
Look, croup is scary. There's just no getting around that. But knowledge is power, right? Now you know what it is, you know what to look for, and you have a clear plan. So when you hear that bark in the middle of the night, you can replace that moment of panic with a feeling of, okay, I know what to do. Hopefully you're feeling a lot more prepared.